everyone, my name is Raj Javeri, also known as the Urban Nerd, and I'm a technologist and investor that has been fortunate to advise, build, and work on many projects related to digital health, such as telemedicine, machine learning and AI in healthcare, smart EMRs, and in the past year and a half, my main focus has been in the clean energy sector, particularly in EV charging and energy load management. But what I wanted to talk about today in this video is related to what's currently going on in the world with COVID-19 and the buzzword topic, telemedicine. For those healthcare professionals out there in the field being in the front line facing this virus, I salute you and I want to help you guys. I'm constantly surrounded by physicians, my wife's a pediatrician, and I keep hearing the different types of video conferencing tools they're using for telemedicine right now. But the folks I've been talking to have limited knowledge on if the tool they're using is compliant or they can use it in a compliant manner in the first place. There are tons of professionals out there claiming to be telemedicine experts. Some are even charging for courses and classes on it, and some are even doing consultation fees. So what I wanted to do is share everything I know about the digital health industry to you guys for free. And when I say everything, I mean everything. We're talking about topics like FHIR databases, the 101s when starting a digital health company, high-tech encryption, building telemedicine practices, mobile health apps, remote monitoring devices, video conferencing technology, HL7, insurance reimbursements, and the list goes on. I have 10 years worth of knowledge in this industry, and with everything that's going on, it's best to share it to the world. Not gonna lie, this is my first video after a long hiatus, so if you want me to keep making more videos, let me know in the comments below, subscribe, share the video, and give me a shout on what you want me to talk about next. Right now, I want to do a quick top 10 telemedicine tips that overviews what you need to do as a healthcare professional when implementing or switching to telemedicine. I'm going to split this topic into 2 videos in order for you guys to have enough time to digest the material. So let's get started. The first tip I want to talk about is choosing the right video conferencing tool. I keep hearing healthcare professionals using Skype, Zoom, FaceTime, or some other tool to talk about patients amongst colleagues, or to patients themselves, or if you're a private practice and you want to figure out how you can utilize telemedicine with some of these tools, you need to find out that whatever you decide to use is HIPAA compliant and encrypted. The free versions of all of these platforms are not HIPAA compliant, so let me stress on that. The free versions are not HIPAA compliant. Video conferencing is a cool tool to have, but when it comes to sharing patient information over video, you need to make sure it's encrypted to high-tech standards. And that's basically a certified 256-bit advanced encryption standard. I know that's kind of technical, but that means basically no servers, including the video conferencing platform you use, should have access to the decryption keys. This keeps your video conference absolutely confidential. Secondly, your practice or hospital system needs to have a BAA agreement with a video conferencing company, which is basically a business associate agreement. In telehealth, HIPAA standards are the responsibility of both the video conferencing vendor and the healthcare provider, and this shared responsibility can be formalized through a BAA agreement. And this agreement is basically a method of sharing the risk and is essentially a promise to be accountable should a HIPAA breach take place. Some big players such as Apple have deliberately chosen not to take on these risks, but others will embrace them and eagerly sign a BAA because they're looking to carve out a section of the video conferencing marketplace. However, even if a software provider claims to be HIPAA compliant and signs a BAA, it's still possible to violate HIPAA rules. All it takes is one untrained staff member who sends the video conferencing link to the wrong email address. So finding a HIPAA compliant service doesn't guarantee everyone in the organization will be compliant, but rather it should be part of your overall security system. Thirdly, the platform should have no recording capabilities. Obviously, you cannot record your consult when patient health information is being shared. There's also times where the platform may have a chat functionality with file sharing to share x-rays, MRIs, or any type of photos, but that also needs to be encrypted as well with the same encryption standards. There are platforms like VC, Video, and Zoom that have HIPAA compliant versions of themselves. So in the end, make sure your practice or your institution have the correct versions when utilizing video conferencing for telemedicine. And definitely remember that they must have a BAA agreement in place. I stress once again that you absolutely cannot use the free versions of these platforms. So don't jeopardize your medical license and just make sure you're using the right version of the tool and there's a BAA in the first place. I know, the last tip or the first tip, was kind of long. So moving forward, I want to make sure the rest of the 9 tips are short and sweet. So on that note, the second tip I have is basically try to use an existing video tool that is already integrated in your EMR system. Zoom Video currently has an integration with Epic and many other major EMR companies out there. And these integrations streamlines notations when conducting a video consult and definitely makes note-taking a lot easier. I know note-taking is a pain in the ass for a good amount of you guys. So imagine all of that being streamlined into the patient's chart. Well, in this case, the medical record. And you don't have to retype everything all over again. Also, in addition, anything that is shared via the encrypted chat channel is automatically delivered into the patient's record, an Epic or any other supported EMR system. These types of integrations makes your workflow a lot easier, faster, and efficient. Tip number 3, if your EMR does have a video conferencing tool for telemedicine, check if it supports remote monitoring devices or have screening questionnaires for patients to answer before having the video consult. You'd be surprised what type of care you can deliver remotely. There are thermometers like the Kinza or the Echo stethoscope, or certain Bluetooth-enabled pulse oximeters or otoscopes that you can actually control remotely and obtain data in real time, including sound and video recordings and photos. Screening questionnaires are amazing to have for patients to answer prior to the video consult, and it definitely gives you a chance to review the questionnaires and their medical history prior to the consult. This enables for consults to be short and to the point during a heavy patient load day. Tip number 4, whatever telemedicine platform you choose, especially those with private practices, make sure there's a scheduling component so patients can schedule video consults a lot better. Usually telemedicine consults range from 15 to 30 minutes, and there are times where it can be longer depending on the chief complaint. So scheduling your appointments out will be extremely crucial if you have a very busy day. Now, if you're joining an existing platform like Teladoc, American Well, or Face-to-Face Health, they will already enable you with a scheduler, and some actually have an on-demand functionality where you can see patients in real time, like if they were just walking into your clinic without an appointment. But if you're a practice that wants to have your own platform, either by building it or licensing some existing one in order to have your branding, like you can do with SnapMD or PatientClick, then make sure it's a robust, interoperable system that have tons of meaningful use features and allows the correct integration so you can continue to evolve your system to keep up with the technology. There are definite benefits of having your own platform, especially when it comes to patient payments and not having a middleman taking a chunk of it away. And also you'll be able to submit insurance claims for patient reimbursements, which is the topic for my next tip. Tip number 5, and the last tip for this video. I will do the next 5 tips in a separate video. And this tip, I want to talk about insurance reimbursements versus cash pay. A good chunk of telemedicine startups that are out there usually do cash pay, but they do have the functionality to enable patients to download a form to fill out and to submit to their insurance company for reimbursements. But there are telemedicine platforms out there with the EMR integration that have the correct telemedicine CPT codes in there. And these CPT codes is also based on, the duration of the video consult that you can submit. And there are companies like PocketDoc, which is not really a clearinghouse, that have integrations to EMRs where you can successfully send a claim to, I think they cover 99% of all insurance in the US. And they can definitely send a claim on your patient's behalf because you are submitting, the payment that you've collected, and then whatever the difference is that you're claiming or that payment, the insurance company ends up mailing a check out to that patient. Another important aspect in order to do that successfully is you have to make sure all your providers in your practice, especially if you're a new telemedicine practice, are credentialed for each particular insurance company that is applicable within that state. So make sure they're credentialed in order to accept insurance in the first place, and then use a tool like PocketDoc in the EMR system, which have a high success rate of accepting of having insurance company accepting telemedicine claims. So that is one good portion that you can successfully do on behalf of the patient, and makes their life a lot easier. Another important note is that insurance reimbursement it varies state by state. There are parity laws on what are the rules regarding how to use telemedicine and how it can be reimbursed. So, a law for a specific state could state that you have to see the patient first in person before you do any telemedicine consults for reimbursement. So whatever state you're in, check what the parity laws are in terms of insurance reimbursement, and also check if how successful your EMRs are in regards to sending out telemedicine CPT codes for insurance claims and the acceptance of that. Thank you for watching this video. I hope these 5 tips were very helpful. I do look forward to putting out the next 5 tips in another video. We'll be talking about, what's the right environment to do a telemedicine consult, the best practices for a physician to do it. We'll talk about e-prescription. We'll talk about how you convert video consults to actual in-person consults if you are a private practice. We'll talk about referral system, and lastly, what exactly you can do during a telemedicine video consult. So, what procedures and what type of diagnosis you can actually do within a telemedicine consult. Once again, thank you for watching this video. Please share this video to any physician, nurse practitioner, PA, PT, any healthcare professional you feel that this is valuable to, and subscribe, leave a comment below on what you want me to talk about next. I'd love to make more videos, especially anything related about digital health, like I said earlier. And if you're also interested in anything related to electrical vehicle charging or energy grid management, let me know in the comments below. Once again, thank you, and hopefully this was a good help to you guys.